5 years ago, Hugo Campos collapsed at the Oakland BART station, a fall that changed his life. Having never expected a heart condition, Campos was diagnosed with hypertrophic cardiomyopathy, leading to the implant of a defibrillator. Campos learned everything he could about his disease, scouring medical textbooks and attending conferences. But what he really wanted was access to the information transmitted from his device. When he couldn't get it, he made it his new crusade, for patients to have access to their medical information. You were a patient turned advocate. Can you tell me a little bit more about the experiences that led you into advocacy?
I have heart disease. I have a genetic type of cardiomyopathy called hypertrophic cardiomyopathy. HCM affects 1 in 500 people in any population. And I had absolutely no idea that I had heart disease until I was 37 years old. And when I was 37, I had run up a flight of stairs to catch a train, and my heart kept going faster and faster, and it just wouldn't slow down. And I passed out on the train platform, and that is how sort of my world turned upside down, and that's how I discovered that I had heart disease. Although it didn't happen quite right at that moment. It took about 3 years for me to get a proper diagnosis. HCM is hard to make a correct diagnosis. So my first diagnosis was for a vasovagal syncope. So they said, oh, maybe perhaps you were dehydrated or something else.
Right, a nervous system response.
Right, something else. Yeah, and so, right, neuromodulated syncope or some other reason. And so, but I did have a follow-up with a cardiologist at some point, and they discovered that I had the mitral valve murmur, but they classified it as a benign murmur, and nothing to worry about. And so, and today I know that a misdiagnosis of a mitral valve prolapse is a common misdiagnosis in hypertrophic cardiomyopathy. So a lot of people are walking around thinking they have just a mitral valve prolapse, and perhaps they have HCM and could even potentially be at risk of having a sudden cardiac arrest.
Right. And how were you treated?
I was immediately after the event, or
for your heart condition.
Right. So with HCM, there's usually the treatment is usually beta blockers, and in patients are assessed whether or not they are at risk of sudden cardiac death. And if they are deemed to be at risk of having a sudden cardiac arrest, then the treatment is an implantable Cardioverter defibrillator, or ICD. And it's a real smart little device that is placed usually on the left side of the chest with 1 or 2 leads or wires into the heart. And the device is capable of detecting malignant arrhythmia and of delivering a life-saving shock to the heart in case it detects ventricular tachycardia or ventricular fibrillation.
So it basically resets your heart rhythm once you have an abnormal rhythm.
Right. And in my case, the device has saved my life a couple of times. I did have 2 events recently, one as recently as May 2012, and another one in October of last year.
And how did having that implantable defibrillator lead you to a path towards advocacy?
Right. These devices nowadays are very complex, and they're very capable. They're really incredible machines, and they're capable of wireless telemetry. So a lot of these modern ICDs and pacemakers are capable of being monitored remotely by the physician. And so, in my case, my device is capable of that, and the doctor prescribed a remote monitoring, and what they do is they give you a box, and you connect it to a phone line, and it sits next to your bed, and it's a very unsexy little box. It's something you don't want to have next to your bed.
Saves your life, so.
Well, the remote monitoring portion might, but it doesn't necessarily. The device itself is self-contained. It's capable of But the remote monitoring is only so that doctors can know if the device is working properly as expected, or if there are any events that require any attention. And the manufacturer uses the data that they collect from the device for a lot of reasons. The primary reason is to provide physicians with reports about the patients in their practice.
Right. But do patients get access to that data?
Patients get no access to that data, right? So, and that is really at the core of my advocacy. And I feel like if the device is in my body and it's paid for, it's mine, it's part of who I am. I wake up with it, I go to bed with it. I should not be devoid of access to the knowledge that the device has about my body and my health. And that's how it works today.
And what did you want to do with the data?
Right, there are a lot of things that we can do with the data. You know, it's one of the funny. I get this question all the time, and one of my first reactions is to put me to. I always get on the defensive because I feel like as the patient and the person who originates the data that is collected by a device that I own, I should not actually have to justify that. So that gets me a little riled up.
Not a
but
justification, but just curious.
Right?
No,
I understand that.
Yeah.
I understand, and no, I understand. And so, but in a sense, there are so many things. And that the way I see this, there are 3 tiers of how this data would be very useful to patients. The most inner tier and the most inner layer is the data from the defibrillator in the context of my own heart disease. For example, the device is capable of looking at variations in chest impedance because it has 2 wires in there, and it can tell if you're retaining fluid. So you can detect edema, potentially heart failure, before the patient starts feeling symptoms of heart failure, days ahead. So it can be very valuable in the hands of a patient who lives in heart failure or with heart failure. There are issues of also another type of data that will be very useful is logs of arrhythmia logs, so that the patient can get feedback on, say, for example, foods or things that provoke some certain kinds of arrhythmias. I track my cardiac arrhythmias with a Google Doc on an iPhone app that I created. It's not technically an app, it's a Google Doc that I access from my...
You can track your own...
Right, and I track symptomatic arrhythmias, right. So if the arrhythmias are, I'm not always symptomatic, if I'm sleeping, I don't track them. And so, but it was through this tracking that I was able to discover that Scotch whiskey puts me in atrial fibrillation, so I stopped drinking Scotch. And caffeine exacerbates my ventricular arrhythmias, so I don't drink caffeine anymore of any kind.
You weren't able to get access to your
Right.
implantable defibrillator data before, but you seem to have access to it now. So what was that process like of actually obtaining that data?
Right. No, I do not have access to it now. The data that is collected by the manufacturer of the device is only accessible by the manufacturer. It's not even accessible by doctors. Doctors only have access to the reports. I'm after the raw data that the manufacturer collects from the device. And this raw data is very valuable to the manufacturer. They use it even for post-market surveillance of their medical devices.
Okay. So how are you tracking your arrhythmias?
When I have an
symptoms?
arrhythmia, I track using my iPhone app. And when I have a symptomatic arrhythmia, I pause, I stop whatever I'm doing. Hopefully I'm not driving. But if I am not driving, I pull up the iPhone and I record the arrhythmia. The iPhone puts a timestamp on it, and I record whether I feel like it's an atrial arrhythmia or a ventricular arrhythmia, the intensity on a 1 to 5.
I see. So these are subjective measures of
Right.
what you feel, not
Correct.
necessarily the raw data, which is being housed with the manufacturer.
Absolutely right.
Okay.
And that is the biggest flaw in my tracking system. It's inaccurate. So it's based on my perception of what the arrhythmia feels like. And I also track my mood because I believe that my emotional status has a direct correlation with my cardiac arrhythmias. So I try to track when am I feeling depressed, or am I feeling down, or I'm stressed out. There are different questions that I ask myself when I respond to my little survey.
I see. So the current status is that patients still do not have access to the raw data.
Right.
What advances, if any, have been made since you first started advocating for this years ago?
The advances that have been made is that we've managed to get the word out a little bit more in the public domain. People are a little more aware of this issue and unfair practice, in my view. And so, really, that's the only good thing that has come out of it so far. But I think we'll get there. I trust that medical device companies are not entirely evil, and I believe that they they are actually missing out on an opportunity that they haven't been able to see, and they are too caught up in the way they have been doing business for the last 20 years, and they don't even see the patient as their customer. The patient is only the recipient of the therapy. The customer to medical device companies is the doctor, is the physician. And so there's no relationship between medical device companies and patients. What I'm after really is transparency. And when I was explaining the 3 layers of how this data could be useful, is data in the context of data from the device in the context of my heart disease, such as, for example, heart rate variability, arrhythmia logs, and variations in chest impedance so that you can know whether you're retaining fluid or not. But there's also data, the second tier is this, when you collect this data from the device in the context of other patient-generated health data from our other devices, my Fitbit, my scale, my Wi-Fi scale that I have at home, my blood pressure cuff. So when you start correlating this data, you can you get a high resolution picture of what the patient's health might look like. So it's very helpful. This is the second tier. And so some people usually see it the first tier, or maybe up to the second tier sometimes. But the third tier, most people don't even talk about it, which is, I think, where the real value lies, is when we use data from our devices for post-market surveillance of medical devices, a system that is broken today. So what I'm after really is transparency and control over my heart disease, to be able to tell if my device is doing what it's supposed to be doing and whether or not it's working effectively, how devices from different brands compare to one another. We don't have these answers, and I think we owe to ourselves as a society to answer some of these questions.
Right. And are you guys just looking at heart disease right now and looking to expand advocacy efforts to other diseases too?
I think this is applicable to diabetes. I think it's applicable to people living with joint replacements. It is applicable to people who live with implanted devices. There are active implanted, class 3 active implanted devices, implantable devices. Or in the case of hip joints and knee joints, not quite, but we need to empower patients to we're living longer and longer lives, and chances are and these devices are getting smaller and smaller and more sophisticated. We need to empower the recipient of the device to care for him and herself. So I think this message applies to anyone who lives with a device implanted in their body, or an insulin pump, or a variety of different things.
Right. And coming from a patient perspective, how do you want physicians to act, and what do you think their role should be in this new wave of patient empowerment?
Right. I think physicians should realize that patients are communicating. Nowadays, I used to talk about this 3 or 4 years ago when we started having, when sort of like the notion and the concept of Web 2.0 was kind of starting to appear, and when we were talking about, people were concerned that patients would be comparing notes and talking about medication and talking about treatments online. This is thankfully, it's way in our past. People are having very educated conversations online among themselves, patients are. And so I think the message to physicians is physicians need to realize that this is happening and get with the program and really not allow themselves to be isolated and really learn how to practice medicine in this new world in which we're all interconnected. And this is going to create new challenges, and it might be very difficult to adjust in certain regards. Some physicians might be concerned that they will be cut out of the care circle. But we need to work together and figure out ways in which we can all benefit from this new paradigm. There's no going back.
Right. I think it's an evolving conversation that's constantly changing as these new technologies enable both patients and physicians to have these different types of conversations.
Right.
So is there anything else that you would like to share with us?
Let's liberate the data.